Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Knee to Know Show, we're going to go over some core strengthening and stability exercises for either before or after your knee replacement surgery. Now, of course, with knee replacement surgery, we're focusing our rehab and our recovery mainly on strengthening the legs, working on the knee and the range of motion, but it's really important and really beneficial to have good core strength and stability, and it's just going to help you more and more with functional daily activities that you want to be able to do after your surgery. So the first one we're going to do is going to be laying down on any type of flat surface, your bed, your couch, if you can get down onto the floor, whatever you have available. And this is going to be called pelvic tilts. So we're trying to move our pelvis posterior or backward, and I'll explain how to kind of feel that as you're doing it. So you're going to lay with your feet up, knees bent, feet flat on the surface. And what you want to think about is taking that small part of your lower back and you're going to push that down into the surface, trying to flatten your lower back against the surface. So you're going to push down and flatten, and you should notice that your pelvis is going to move in a backward direction, back towards your back or back down into the surface. So you're going to do that tilt, bring your hips and pelvis back, hold for maybe 3 seconds, 5 seconds, whatever you feel like, and then just relax. Push down and relax. It's a very subtle motion, doesn't have to be super intensive, tightening and bracing all your abdominals. You're just doing enough to flatten your low back and then relax. Now, once you get comfortable doing the pelvic tilt and feeling that motion of your pelvis forward and backward, now we can incorporate some movements of your legs. So what you're going to do, so one of them is called bent knee fallouts. So you're going to do that pelvic tilt, trying to push your low back down. Now you hold that position and you're just going to go bring one leg down and then slowly bring the other leg down. And then relax and reset. Then do that pelvic tilt again, one leg down and back, other leg down and back, and reset. And usually I'll do 10 to 15 repetitions of that. Another one you can do is perform your pelvic tilt. So push that low back down, and then just do a march, march, and then relax and reset again. Do the pelvic tilt, march, march, and then reset. Those are just two basic ways that you can start to incorporate movements of your legs. There's a whole different variety of ones that you can use. You can do straight leg raises. You can start to incorporate things with your arms, but those are just some basic ideas. The next one, kind of building off of this a little bit, is going to be the dead bug exercise. And this one's kind of a step up from the pelvic tilts that we just did. So for this one, you're actually going to bring your knees up in your legs. So you're going to have them about at a 90-degree angle with your trunk. And you're going to hold that position. And then you're also going to hold your arms up straight in front of you. Now at first, just to start to build up some strength, just practice holding this position. See if you can hold it for 10 seconds and then relax. And then maybe work your way up to maybe holding it for up to 30 seconds. Now what you can also do, again, is start to incorporate some movements of the extremities. So one thing you can do holding this position is just do one leg down and up, the other leg down and back up. And you can do that. You can also do your arms. So you can bring one leg, flex one shoulder up and then back, flex the other one, and then back. And then you can also incorporate, if you get really good at it and get really strong and comfortable and good coordination, you could do both arms and legs at the same time. So you can do opposites or diagonals, which is really kind of incorporates your functional movement. If you think about when you're walking, you're going to use opposite arm and leg. And you can even do the same side, which is a little bit challenging and challenges some different muscles as well. So start with the basics, see if you can hold this position, try to do a little bit of that pelvic tilt, keep your core and your abdominals engaged, and then start to play around with it. Start to see if you can incorporate some movements of the legs as well. Another great core exercise is planks. This might be a little bit more intensive, challenging for some folks. I would encourage you that start with a higher up place. So maybe doing planks against the wall, front planks and side planks against the wall. Maybe moving down to a chair or doing it like on the armrest of your sofa can be an option. And then if you get really comfortable and really good at it, eventually move to doing it down on a flat surface, either on the floor, on the bed, or I'm going to show you here on the massage table. But again, this is a little bit more intensive, so you might not be quite ready for this one, but I'll show it to you because I just think it's a great exercise. So for planks, you're going to get onto your stomach, and just kind of the simplest form of it, and you can do it on your forearms and your elbows, or if you feel comfortable, you can do it with your arms out extended, So first with your arms, on your forearms and your elbows, and you're just going to push through your feet and your arms and lift your body up. Now, the key with this is just trying to keep as neutral a body position as possible. So again, incorporating those pelvic tilts that we did initially. Sometimes people, when they do a plank, they'll really talk about having a lot of pain and discomfort in their low back. And part of that is because you're arching, so your pelvis is moving forward or anterior, and it's causing this arching or extension of your low back, your lumbar spine. And so if you're able to incorporate that pelvic tilt, engage the abdominal muscles, that can help ease some of that tension and discomfort in the low back. And so, very basic, that's a front plank, and just working up, trying to hold it. If you're doing it up against the wall, if you're doing it against a chair or an armrest, trying to build up to maybe 30 seconds to a minute holding it, and then going from there. And then of course there's also side planks as well, which if you want, which can be really helpful, is if you start from this position, so start your side planks going from your knees like this, can be a little bit easier to kind of get comfortable with doing it. You might not have the strength yet to do an all-out side plank, but again, this is an awesome exercise as well. And so now I'm going to switch things up and show you one more set of different exercises that you can do for core stability using a Swiss ball or a physio ball. Alright, so one more type of exercise I love to do with people for core strengthening is some activities sitting on the physio ball or the Swiss ball. Before I jump into that, be sure to hit that subscribe button if you don't already subscribe so you can catch all of our videos related to knee replacement surgery. So what I like to do is just get the client on the physio ball and sitting up nice and tall, nice and upright, and just first off getting comfortable with sitting on the ball, maintaining good stability with certain movements, certain activities. So you can do some circles around both directions. You can do weight shifting side to side, forward, backward, and just get comfortable sitting on the ball and keeping your stability. Then what I like to do is start to incorporate some movement with the legs. So we can do marches. Again, make sure you're sitting up nice and tall as you do it. You can do some knee extensions. You can also incorporate movements with your arms. You can do chest press up and down. Of course, feel free to add weights if you feel comfortable. You can do abduction, adduction. You can do bicep curls. You can do chest press in and out. Anything that's going to be kind of a dynamic movement to kind of move your body and force your engagement of your core and your abdominal muscles to keep your stability, keep your good positioning while sitting on a moving, unsteady surface of the Swiss ball. So I hope you found these exercises beneficial and insightful. Please be sure again to hit that subscribe button if you don't already. Leave your likes, leave your comments and questions below, and I'll do my best to get back to you. Thank you very much for watching.